Let's pivot to talking about how you can reverse type 2 diabetes. Because remember, different to type 1 diabetes, which is thought to be not reversible, we're talking here about an acquired and preventable disease that is taking over the world. And the 2035 projections for obesity and type 2 diabetes are staggering. And the cost and the burden on healthcare systems the world over is going to be something backbreaking. And what's so sad about this is that it's a preventable disease. And it's a disease that we're seeing more and more in a resource-constrained environment because people who are resource-constrained can't afford healthy food, which is a terrible byproduct of our current food system. Remember that Paleolithic man did not sustain himself on grain. He was hungry most of the time. He was fasted most of the time. And so his body, metabolically, was adapted to using a different food source or energy source than glucose. Paleolithic man was running on what we call ketones. And ketones are present in our bodies when we are fasted, so we have not eaten for at least 16 hours, or if we have not eaten even for a few days. And this is becoming part of the healthcare narrative, and there are even studies now using intermittent fasting or fasting tools in the context of a type 2 diabetic patient as an adjunct to medicines, which is pretty revolutionary, and 5 stars for the pharmaceutical industry for even talking about this, because it's not going to make them any more money. And even in the context of cancer, metabolic therapies like fasting are being used as adjuncts to chemo. And shifting your body's utilization from glucose to ketones can have profound effects on all organ systems. So if you are somebody struggling with that middle spread, or you are somebody who's on the trajectory to becoming a type 2 diabetic, please pause right now and begin today by going and investigating some of these tools, because they are quite simple to implement. They aren't going to cost you any money. And implementing a simple 16-8 protocol where you're only eating in an 8-hour window and fasting for 16 hours is something that most people do not find too difficult to do. It's important to say right now that if you are taking medicines that lower your sugar levels, you should do this in conjunction with your healthcare provider. Because if you start fasting and you don't adjust your medicines, you might find that your sugar drops too low, which is amazing because it means you need less medicine. But that's something that's really important to be supported in, because you can run into trouble. So that's my little sidebar about fasting. The other thing that you can do to help support a pre-diabetic or insulin-resistant body is to cut out carbs and refined sugars. And this is really difficult in the obesogenic environment that we live. The easiest thing to eat, regardless of where you are, is usually a white bread sandwich with something sugary or fatty on it. And even when you are reaching for low-fat options, they're usually bolstered with lots of sugar and salt to make them more palatable. And so where I'm going with this is reducing your carbohydrate, or at least your refined carbohydrate intake is extremely important. The other helpful tip is to remember that fiber in food slows down the release of sugar into your bloodstream. When you eat an apple, compared to drinking a glass of apple juice, your body is having a very different experience. The apple is loaded full of fiber, and that fiber is going to slow the release of glucose into your bloodstream. The apple juice, all of the fiber has been stripped, and maybe you've got 6 or 8 apples in a glass. Would you ever eat 6 or 8 apples? No. Would you ever feed your child 6 or 8 apples? No, you wouldn't. And it breaks my heart when I see juice boxes in children's lunch boxes or in children's vocabulary. My 3-year-old came home from a play date the other day and told me she'd had Coke. And honestly, I nearly cried. These are not things that children should be exposed to. And there is so much data to support that these sorts of foodstuffs in a child's body have a measurable and significant negative impact on cognitive function, on relationality, on energy, on sleep, on focus and attention. And we can extend all of those things to the adult brain too. So don't drink your calories, don't drink your fruit. And remember that the higher the fiber content in your food, you can even start to learn to read labels. When you buy your loaf of bread, first of all, make sure it doesn't have 20 ingredients in it. And unfortunately, the cheapest, most affordable bread generally does. It's also the fluffiest and the most palatable and the most Moorish. There are actually food scientists whose primary reason to be in the world is to make food as palatable and as Moorish as possible. This was a vocation that did not exist 50 years ago. And our bodies have changed dramatically in the last 50 years. If you go into a vintage dress shop, I can guarantee you that even if you are a healthy, normal-sized person in today's context, you won't find anything to fit you. And this is an interesting reflection. And I think that whilst fat shaming is the last thing that I want to do right now, if anything, I have so much deep empathy for people who are finding themselves in these situations and are suddenly awakening to these realizations and then trying to backpedal. It's so important that we have empathy and gentleness, and that we look at all the various tools that we have in our armament to approach these things. And resources and the environments in which we live make this ever more difficult. The other thing that is really, I think, important to name is when you've been carrying a lot of extra weight for a long time, there is a theory called set point theory. And set point theory says that if you've been 100 kilograms for a year or two, your body will do whatever it can to stay at 100 kilograms, even if it's an unhealthy weight. And so if you decide at 100 kilograms that your goal is 80 and you're going to make some big changes, your body is not going to support you. You're going to feel more hungry, and your metabolic rate actually slows down. And we see this in animal and in human models. And so getting support, if this is a journey that you are on, is absolutely integral. Because if you have been engaged in a certain habit for a really long time, having somebody support and cheer you on to change it will make the world of difference.